This resource is being made available by Senior American Agency and MedicarePlanChoice.com. If you're watching this video from a DVD disc, telephone support is available every business day, Monday through Friday, 8 a.m. to 3 p.m. Eastern Standard at 800-332-7557. To get support inside the MedicarePlanChoice.com website, click on Web Chat or Health Coach and follow the instructions. This video will focus on the element of Medicare known as Part D, the prescription drug benefit. This Medicare Part D segment completes the video overview of the Medicare system. By watching the Medicare Basics, the 2 ways to get your Medicare benefits, the Medicare Advantage and Medicare Supplement videos, you should have an understanding of all the parts of Medicare. This video will focus on the Medicare Part D prescription drug benefit. We'll cover how to enroll in a plan, the basic elements of a Part D plan, and of course, the donut hole. In order to enroll in a Part D plan, there has to be something called an election period. We're going to look at 4 common election periods used. The first being the initial election period. This is when you're turning 65 and getting Medicare for the first time. You have the 3 months before, the month of, and the 3 months after. Any one of those months you can enroll in a Part D plan. The annual election period runs between October 15th to December 7th every year, and during those times you can add or subtract Part D plans. Special election periods, if you're eligible for one of those, can typically be used anytime during the year, and the annual disenrollment period actually is for people that are on a Medicare Advantage plan and want to go back to original Medicare. If they do that, they are allowed to enroll in a Part D plan. So we will include the annual disenrollment, but that's only for people that are leaving a Medicare Advantage plan and going back to original Medicare. So those are some of the common Medicare election periods to enroll in a Part D plan. The 2 most common are going to be the initial election period when you're turning 65 for the first time, the 3 months before, the month of, and the 3 months after, and the annual election period every year between October 15th to December 7th. Medicare Part D plans are available in 2 formats, the first being a standalone PDP or prescription drug plan. That's available to someone who has either original Medicare and some private fee-for-service Medicare Advantage plans that only have doctor and hospital benefits within them. So those people are allowed to have a separate standalone PDP prescription drug plan. The second way that a prescription drug plan is available is inside of a Medicare Advantage Part C plan known as an MAPD, or a Medicare Advantage prescription drug plan. And that's simply a Part D plan that's wrapped inside of a medical doctor and hospital plan. So the formats that we've discussed in the Medicare videos that would have that are HMO, PPO, private fee-for-service, and special needs plan. So essentially, if you have a Part D plan wrapped inside of a Medicare Advantage plan, it's an MAPD, or a Medicare Advantage prescription drug plan. So those are the 2 different ways that people can get Medicare Part D plans. Many people will take a Part D plan when they first get onto Medicare simply because the cost of prescription drugs is going higher and higher, and people need assistance with those costs. All Part D plans are administered by private insurance companies, and anybody that's eligible for Part A or Part B of Medicare is eligible to join. If you don't join a Medicare Part D plan when you're first eligible in some form, you might have to pay late enrollment penalties in the future if you didn't have something called creditable coverage, which is a prescription drug plan that was equal to or greater than the average Part D plan. The famous donut hole, we're going to talk a little bit more about what that exactly means, but essentially it's a lack of coverage inside and outside of other coverages. And Part D plans are all formulary driven. That means each Part D plan will have a list of covered drugs. It's important when you join one to make sure that the drugs that you take are on that formulary and which tier or which cost level that your drugs fall under. Next, we're going to break down the individual parts of a Part D plan. Although no 2 Part D plans are exactly the same, all Part D plans have 4 stages. Stage 1 is the deductible stage. During that time period, you pay all of the costs. The plan pays none of the costs. The plan deductibles for the year 2013 range between $0 to $325. Stage 2 is the initial coverage period. You would pay some costs. The plan would pay some costs of the drugs until the total cost of the drugs of what the two combined paid were $2,970. At that point, you would move to Stage 3. In Stage 3 is the coverage gap or the donut hole. The reason why they call it the donut hole is there was coverage prior. There can be coverage after, so the term the donut hole. During that time period, you pay a reduced amount for the prescription drugs. Brand names, you would pay 47.5% of the discounted retail price. The generics, 79% of the discounted generic price, until the out-of-pocket expenses were up to $4,750. And then you would move to the Stage 4, which is the catastrophic coverage. During the catastrophic coverage, you pay the greater of either $2.65 for the generics and $6.60 for the name brands, or 5% of the drug cost, whichever is higher. So that's just a breakdown of the 4 different stages of a Part D plan. If your income and resources are low, you might qualify for Part D assistance. There's 2 primary sources, directly through Social Security. It's called extra help through Social Security, or the low-income subsidy. There is income and resource limits that apply. You can see the numbers on the screen. These numbers do change from year to year, but essentially, if you're a single person and have roughly $16,000 and under of income and $12,000 and under of resources, you might qualify. If you're a couple and you have under $22,000 of income and $25,000 of resource, again, you might qualify. You can get applications through the local social services office, and you can apply directly at Medicare.gov. There are state pharmaceutical assistance programs. These are obviously run state to state. They do have different qualification levels, and again, they're for people with lower incomes. There's other help through social services. You can contact your local social services office and see if you might apply for other resources that might be available. And obviously those resource limits and income limits change from year to year, so keep abreast on your changes through Medicare.gov, or they're usually published in the Medicare and You guidebook each and every year. So there is Part D assistance if your income is on the low side. Call Social Security directly on the phone. Go to Medicare.gov. There's lots of ways to apply. Talk to your local social services office. Give us a call. We'll point you to the right direction. I hope you have a better understanding of Medicare Part D plans than before you started watching this video. Continue to utilize this website to gain the knowledge you need to make smart Medicare plan choices. Telephone support is available every business day from 8 a.m. to 3 p.m. Eastern Standard at 800-332-7557. For support within the MedicarePlanChoice.com website, click on Web Chat or Health Coach and follow the instructions. To ask a question or to get a quote on a Medicare Part D plan, click on Get a Quote or email dan@senioramericanins.com. Include your state, county, and zip code. Thanks for watching this video today on Medicare Part D plans.